We all know someone who's had a bad fall, right? It's a huge problem. But what if one of the biggest culprits wasn't something obvious like a slippery floor, but something totally hidden inside your own body? Well, today we're going to dig into a really surprising condition that might be affecting millions of people who have absolutely no idea.
Yeah, just think about that for a second. What if a major reason people fall was completely silent? I'm talking no warning signs, no dizziness, no feeling like the room is spinning, nothing. That is the exact medical mystery we're cracking open today, and it's all based on some pretty eye-opening new research. So, our story starts in a place that makes a lot of sense, a falls clinic. These are the specialized centers where folks, usually older adults, go to get answers. They're trying to figure out, why do I keep falling? They're looking for real solutions to help them stay safe and, stay on their feet. Okay, so inside these clinics, some researchers started looking very closely at a suspect they thought was hiding in plain sight. They had this hunch, right, that a really common but super misunderstood condition of the inner ear was playing a way bigger role in falls than anybody was giving it credit for. And that condition is called benign paroxysmal positional vertigo. Yeah, it's a mouthful, I know. We'll just call it BPPV. But even though the name sounds super complicated, the actual problem is, well, it's basically a plumbing issue in your ear. See, deep inside the balance center of your inner ear, you have these teeny tiny calcium crystals. And BPPV happens when some of those little crystals break loose and start floating around where they're not supposed to be, messing up the signals your brain gets about where your head is in space. So, with this in mind, the researchers tested over 600 patients at these falls clinics for BPPV. And what they found was, wow, just staggering. A full 39%, that's nearly 2 out of every 5 people, tested positive for this inner ear thing. And let's be super clear here, we're not talking about the part of your ear you can see. This is all happening deep inside the vestibular labyrinth, the body's balance headquarters.
Okay, so right about now, you're probably thinking the exact same thing most doctors have thought for years, right? You're going, hold on a sec, doesn't BPV cause vertigo, that crazy room-spinning dizziness? Surely people would know if they had it. And that, right there, is where this whole medical mystery gets really interesting.
And here it is. This is the big twist. Of all the patients in the study who actually had BPPV, a whopping 26%, that's more than 1 in 4 of them, reported having zero dizziness. None. Zilch. So they had the physical problem, right? The loose crystals throwing off their balance system, but they weren't feeling any of the classic symptoms that would tip them off.
So this is the absolute heart of the discovery. This silent BPPV is a huge, hidden risk factor for falls. You've got people losing their balance, sometimes seriously, and because they don't feel that telltale dizziness, the real root cause, which by the way is a very treatable condition, is getting completely overlooked. But the mystery actually deepens a little bit when the researchers took a closer look at which of the tiny canals inside the inner ear were being affected. Because it turns out not all BPV is the same, and where those little crystals end up makes a huge difference in whether or not you feel it. And this is just fascinating. The data showed that when BPPV only affected a single canal in the inner ear, 38% of those patients had no dizziness. But when multiple canals were involved, that number dropped down to 18%. So what does that mean? It means these simpler, less complex cases of BPPV are actually the most likely to be silent. And that, of course, makes them even trickier to catch. Okay, so all of this leads us to a really, really important question. If we can't count on someone feeling dizzy to point us toward a major cause of falls, what are we supposed to do? How on earth do we find this hidden danger? Well, lucky for us, the research gives us a crystal clear answer. And here it is, right from the horse's mouth, the study's own summary. The conclusion couldn't be more direct. Screening for benign paroxysmal positional vertigo in all people who fall, whether dizzy or not, is required. There's no ambiguity there. It needs to be a standard part of the toolkit for anyone who's had a fall. So what this research is really calling for is a new, pretty simple protocol. Step 1, every single patient who is at risk of falling needs to be checked for BPPV. Step 2, and this is the game changer, we have to stop using dizziness as the only reason to test. And step 3, the testing itself has to be thorough. You've got to check all of the inner ear canals to get the full picture. So what's the big takeaway for you, or maybe for someone you love? It's this. A really common reason people fall might be caused by something that can be fixed, often with just a few simple head movements. It's so empowering to know this. Just because you don't feel dizzy doesn't mean your inner ear is off the hook. Advocating for this kind of comprehensive screening could be the one thing that leads to a diagnosis, gets you the right treatment, and dramatically reduces the risk of a really bad fall.
So, we'll leave you with this final thought. We often look for these big, complicated solutions to big, complicated problems. But in this case, the answer might be so much simpler than we ever imagined. Could it be that for so many people, the key to preventing a life-changing fall isn't some new drug or surgery, but a simple, painless test of the inner ear? It's definitely a question worth asking your doctor.